Okay, we're here with Tom Cataldo, a founder of Better Vision for Children. Tom, I'd like to ask you to talk a little bit about your history, like what you have done in the past and how you decided to start this organization.
Well, most of my adult life has been devoted to the development of products that fill a real need out there, a void, or perhaps they would also save lives or give people a better quality of life. And started doing that almost as soon as I got out of engineering school, and did quite a bit of that even with the big company I went with out of engineering school, Westinghouse, and learned a lot about not only developing products but getting them patented, and because I was involved in that part of the Westinghouse international entity. And then about 10 years after that, I basically started my own business because I wanted to develop products myself and market them myself. And just about the time I started doing that and had some good products out on the market, my mother back in Boston had an emergency, fell down, couldn't get up. Nobody was living with her at the time, so nobody knew she was about to die, except for a neighbor who was curious and found her lying on the floor. So I went back there and found that there wasn't anything on the market. I tried to get something from the phone company and from other places. Nobody had anything like this that would enable someone in a life-threatening emergency to call for help. And my brother, who tends to be a wise guy, said, well, look, you're an engineer, for God's sake, why don't you develop something? And I did. It wasn't that hard to do. What was hard was getting the approval of the Federal Communications Commission, because it had to be plugged into the telephone system, using radio frequencies. And I also had to get the benefit, the approval of the phone company, which at that time was a monopoly, one business that you had to deal with if you wanted phone service, La Belle. And so it took about 2 weeks to develop a product, and about 3.5 years to get the approvals that I needed. In the meantime, I was getting major publicity because I had sold a bunch of them to the Veterans Administration, who did not need the FCC approval since it was another federal agency, and they bought, I don't know, 600-700 of them. They were using them to keep veterans out of hospitals. Very good for everybody, including, the taxpayer and the hospitals and the veterans who could live at home. And yet I was struggling all through that period trying to get the FCC approvals, and when I started getting mega publicity, I was written up in Time Magazine, Reader's Digest, everything. People Magazine, That's Incredible, Good Morning America, went on and on and on. As a result of that, I was getting invitations to go all over the world, to Australia, Japan, England, Ireland, and I did go to those places because I was getting desperate. And in going to these places, and especially to Australia, I was able to get major orders for these medical alert and security alert systems. I had developed a security version also, which could be used by the police and by prison systems and so forth. Anyway, so I came back to Los Angeles with about $2 million worth of business for something that I had really not even made yet, in quantity. And that basically turned everything around. And so from that point on, it was not too long after that I got the FCC approvals and got more money than I ever wanted. I mean, at that point, I was on the verge of going public and had no trouble at all getting funding. We were getting a lot of money from orders. We were selling the product all over the world. And then right about that time, my son got killed in an accident. We decided to bail out of LA. and moved to Mexico. And yet I kept developing products even after that. And one of the ones I developed was a product for screening the vision of children. Why? Because I've been legally blind from one of these things all of my life for no good reason. The vision in one eye is 0, and then the other eye wasn't ever very good to begin with. And then when I went into the Navy, when I was still like 17, I had an accident in the Navy that wiped out a lot of the vision I had in that eye. But it just, and that's very common, by the way. The people that have amblyopia, which is the technical name for what I have, it very often is one eye, but by virtue of the fact that the vision in that eye is greatly diminished, you have no depth perception, you have accidents much more easily, twice as easily, according to major universities like Johns Hopkins, who've studied the hell out of this.